Welcome to Startup Health TV. This is a special health innovation update. I'm Logan Plaster, editor-in-chief at Startup Health, and I'm fortunate today to be joined by Cassie Lindholm and Kelly Nalexala from Upper Great Lakes Family Health Center. Today is a special episode because we are getting into the weeds with an actual case study about how a health innovation company really gets implemented at the clinic level. So really excited to have Cassie and Kelly with me today and just get into your story and particularly your collaboration with one of our portfolio companies, HealthTalk A.I. So Cassie, Kelly, thanks for joining me.
Thanks for having us.
Let's just talk about your Upper Great Lakes Family Health Center. Just describe for me the setup.
Sure. So we're a federally qualified health center. We're located in the Upper Peninsula of Michigan. So it's a very rural area, very underserved area. We have 10 clinic locations within our organization. They're very spread out. So there's lots of travel challenges, patients getting to clinics, all of that kind of stuff that affects access. We provide family practice, pediatrics, OB-GYN, behavioral health, dental, as well as substance use disorder services. So we have a lot going on. And annually we serve about 25,000 patients.
Okay. What would you say, you said the rural nature creates travel challenges, obviously a big topic with telemedicine today. What are some of the other environmental challenges, determinants of health challenges that might be unique to the UP?
Sure. Transportation is definitely a big issue. Patients not being able to get from their homes to the clinic for their healthcare services. That's something we see a lot. Additionally, in our area, we get a lot of snow. So we definitely have those days in the winter where nobody can leave their homes. That's patients and that's providers and staff because we got so much snow the night before.
Paint me a picture of just how rural parts of the Upper Peninsula really are, just so that people who are watching this, who are from the Mid-Atlantic, like I'm in Baltimore right now, help us understand what that really means.
Kelly's a local.
Sure.
You want to take this one?
Absolutely. So a couple of our practices are in Houghton County, and in there, like we do have a technological university, so we do see some cultural diversity and stuff like that, and it's a little bit of a bigger population. But some of our outlying clinics in like Iron River, Michigan, or Gwynn, Michigan, those populations are only about 12 to 1,500 people. We have a big spread. Our counties are big. As well. So for the populations that we serve, we do have people travel from, up to 60, 70 miles to see us. There's some of our populations face access issues as far as food security. We do have one town that we have a clinic in is a former Air Force base. And they don't really have a grocery store where you can go and get fresh produce. So we have a community health worker staffed to help connect patients to resources, but it is certainly a challenge.
So obviously we're talking today about your collaboration with HealthTalk A.I. and the way that a teletriage tool with an AI engine can kind of help some of these access issues. But before we get there, why don't you talk about sort of the process of trying to meet this access challenge? Maybe there were other things that you did along the way, ways of thinking about how do we reach people where they're at and increase access.
Sure. So this really happened because of COVID. In mid-March, we came to that realization that we need a way to be able to efficiently contact all of our patients and let them know about these changes that are happening in our health center, how patients can get connected with these testing services. And with our current setup without HealthTalk, we aren't able to do that. So that's really where the partnership originated, is about mid-March of this year. And we actually ended up implementing HealthTalk over a weekend. It was a very short implementation turnaround time.
Wow.
We met on a Saturday morning, I think. Got through the implementation part, and then we were ready to go live with our first project that next week. So that very fast turnaround time to be able to implement that first survey where we contacted our patients, inform them that we're still here for you. We're able to screen for symptoms and connect patients to testing. That was our very first use case and proved to be successful.
Let's break it down really granularly. So you say before this, you knew you had access challenges, but it didn't become so acute really until COVID hit. So prior to implementing HealthTalk, and we'll get into exactly what it is in a second, how would you have, if you had to reach out, what would that have looked like? If you needed to contact everyone and let them know a piece of public health information, what would you have done?
Sure.
It would have been a lot of manual outreach. If we needed that two-way interaction, we did have the capability to send a message via email or something like that, but that doesn't allow patients to respond back. So if we wanted that same two-way communication that we were able to achieve with HealthTalk, it would have been very manual. Anything to add, Kelly?
I mean, I think Cassie spoke to it. The critical data point was the patients being able to respond. You know, like we can email patients, we can send them a portal message. Our EHR even allows us to text a patient, but it doesn't allow us to say back to us. It's basically just a shout out saying, "Hey, we're open. We're offering A, B, and C services." Whereas HealthTalk allowed that real-time response and allowed us to help engage our population that way.
Okay, that makes perfect sense. So you knew you had this issue. Did you know you needed a product that would allow for an AI-assisted chat, or did HealthTalk did the technology itself present to you an opportunity that maybe you hadn't considered before?
I would say it was really the two-way communication need that we saw.
Okay.
I don't know, I guess I didn't have any expectations for what that would look like. The AI piece certainly has proved useful though.
Okay.
Absolutely. Yeah. I would say that the main driver was like a two-way communication solution for patients, but sort of having an AI bot that could do surveys and send different questions based on responses was a huge advantage.
Given that HealthTalk is new, how did you hear about them? How did you come together?
So we had done some work with Curious Consulting in the past, and Curious is a partner or has a partnership with HealthTalk. So that's how we got connected. I got an email from Curious about the services that HealthTalk could provide in response to COVID, and just recognized that this is exactly what we're looking for. So then we got together over a weekend and implemented it that next week. It was very quick.
Very nice. Okay, let's talk about the implementation and what that first project was like. Just sort of beat by beat. How did you use the platform and the software?
Sure. So our first project was outreach to patients to let them know, first of all, that we're still here for them. And this was mid-March, so when COVID was still kind of relatively new. We also built a survey questionnaire to screen patients for symptoms. So were they short of breath? Did they have a fever? And then using that AI based on the responses, we would get those patients connected to our office for a test.
Okay, so text-based SMS?
Yeah.
Okay,
yes.
And so it's able to not only burst out, but actually have a conversation. So you work with HealthTalk to create your own internal screener tool. Say, these are the questions we want to ask them based off of the information around COVID that we want to know. And they're able to have kind of a bounce back and forth with the chatbot. Am I correct?
Mm-hmm.
And all of this information is feeding your EMR or somehow on your own dashboard, correct?
Yes. So it was, it's a HealthTalk is their own system, and we were able to find patient responses, how many patients responded, how many we reached out to, and then how many, like what patients scheduled appointments, because there's a scheduling piece in HealthTalk AI as well. So if the patient would like to get tested, or have a phone visit with a provider or a telehealth visit with a provider, they can opt into that and get scheduled with a triage nurse. Well.
How many messages did you kind of push out to the world in that first burst?
Sure. So the first burst, we tried to capture our entire population. We ended up reaching or getting text messages out to about 21,000 patients.
Okay.
During that first burst, as far as like patients like filling out the survey, we ended up with about 13,000 patients that ended up responding. So we had a good response rate.
That's really good
for it as well. Mm-hmm.
Any sort of anecdotes about how people felt about being reached out to by a chatbot? This is kind of like a step up in technology from just getting an email from you.
Absolutely. I think in lieu of COVID, there were also multiple scams going around as well. So we had a couple patients call the clinic and say like, hey, I got this text message that said that it was you. They were checking to see if it was legit. One big thing, we put a message up on our website that said like, hey, you guys might see a message from this number. This is us. If you see something, feel free to engage and answer that. This is just another way to serve you.
Got it.
I would say that a majority of our patients, though, were very appreciative of us reaching out. And again, this being back in mid-March, there's so much uncertainty about COVID. No one, really knows what's going on. Kelly and I kept a close eye, especially, on our first outreach round of those responses that are coming back from patients. And it's funny because we definitely had patients that must have not realized it was a bot, because they would send back messages like, thank you so much for reaching out, or like the prayer hands emojis, and just such great responses that came back that way. So we definitely did have some patients who were a little bit wary of the new technology, but as Kelly said, posting that on our social media and on our website that we are texting you, this is the number, it's legit, that was helpful. But a majority of our patients were appreciative of the outreach.
How do you feel like, it seems like you did have a pretty successful response rate. How do you feel like the success of an automated conversation with patients, I'll rephrase that, has it changed the way you think about some of your strategy around other communication? Like, does this open up for you other possibilities of automation and communication?
Absolutely. So, we've had conversations within our organization about potential use cases for a system like HealthTalk before. And, what we thought of originally is outreach to patients who are due for cancer screenings or other services like that. So, and that potential is definitely there with HealthTalk. It's just kind of shifted in priority since, we had to respond to COVID and dealing with that. But, as we engage with this platform in the future, that's definitely where I see it shifting back to, is how can we reach out to patients who haven't had an appointment in a year, or are due for their cancer screening, or are due for a flu shot. Again, it takes a lot of those processes that in the past have been very manual, or, resulted in not a lot of engagement with that patient. There's only so much engagement that you get when you send out an email blast.
Mm-hmm.
So taking some of those workflows and using HealthTalk to facilitate that communication, we're excited to explore those use cases in the future.
Absolutely. And then even with like a scheduling functionality that HealthTalk has, if the patient would like to get connected with, say, one of our population health nurses or population health workers, they can do that. Another thing I want to add quick is just simply the fact that you can add like a link in the text message, right, to maybe the CDC's website about diabetes, or a resource that we've put together to help educate the patient as well. So something that they can take and read on their own time. We're very excited to develop it further. Interesting.
Kind of a shifting gears a little bit more global. You occupy a space of kind of a mid-size, correct me if I'm wrong, kind of a mid-size group. You've got massive health systems on one end, and you've got, mom and pop clinics, just a single shingle out on the other side. And you're in this space with, you said 10 clinics over a region. And I wonder if on one end, that gives you opportunities because you're nimble, and on the other hand, compared to a large hospital system, I could imagine it being challenging to roll out new technologies. And I wonder if you could speak to some of that opportunity and challenge of being the size that you are. You don't have the benefit of, like, the chief information officer of the Mayo Clinic, whatever kind of clout that he brings. Those challenges are the same for a mid-sized group and have to be worked through in a unique way. So I don't know, what are some of the unique aspects of implementing new technologies in a group of your size?
Sure. So I think the kind of main theme with Health Talk is that it needed to be at least somewhat, we needed to have some sort of gradual process for it. Even training staff on the functionality and getting them logins and getting them set up, doing that virtually is a challenge in and of itself. So our approach for every new technology implementation has always been to start with a clinic, maybe even start with a provider team, work out some of the kinks there, and then move through the rest of the clinics. And then, each population, each provider, they have different thoughts and ideas about systems and new technology. So being able to sort of handle that in these, sort of clinic by clinic, it's labor intensive, but it is more effective than sort of like throwing something out there and saying, all right, go, we're reaching out to 25,000 patients today. It was easier for us to go do a couple days at a clinic, a couple days at another clinic, and move forward in a metered type of sense.
That makes sense.
And one of the great things about Health Talk was that the way that it's structured is really flexible to fit what your clinic workflows are. So there was less of us on our side having to adapt what we do to meet the system's needs. The system was really flexible, so that this is our normal process, so we're not adding too much into that normal process for the system to work. So I think, not only was it a low lift on the implementation side, but as far as rolling it out to users, it's also a lower lift and things that they had to change in order to accommodate the system. So that's something that we really appreciated, and I think it really helped to contribute to some of the success that we saw.
That makes sense. What kind of advice would you give to a healthcare startup that's trying to sell into a health system like yours? We represent 330 different companies, hundreds of founders who are all thinking about how do I get in front of groups like yours. So just practical advice for them.
I think being adaptable is number one. I mean, in this healthcare space, things are constantly changing. Like, we saw COVID obviously as the latest disruptor to the healthcare system, but there's always something. There's advanced payment models. There's other things that are changing, that really changes and influences what we do on the practice side. And it's so important that any platform or system that we work with can quickly adapt to those changes to meet our needs as well. So just adaptability, staying on top of these healthcare trends and changes to give us as practices the tools that we need to meet these requirements.
That makes sense. Yep. Final word of wisdom from you, Kelly?
No, she said it. Yeah,
she nailed it. I understand that there's a webinar coming up. You guys want to plug that? Remind people watching this when and where that is.
Sure. It is Thursday, July 9th at 3 o'clock Eastern Standard Time. So Kelly and I will be presenting along with Shannon Nielsen from Curis Consulting, and also Jared from Health Talk. So we'll be talking about access, how to measure access, how COVID has potentially impacted your access program. Kelly and I will go over how Health Talk has allowed us to expand our access to care through text messaging and telehealth. And Jared will talk about the the Health Talk system and how it also contributes to access. So yeah, very excited for that.
That's awesome. We'll make sure that that information is in the description of the video. And you actually just mentioned, and I realized I hadn't asked you about sort of your success metrics. That's going to be part of the webinar. How are you measuring success with this project?
Well, with the surveys, it's really on that response rate, right? Like our patients responding to these surveys, and then with our, we did so much around COVID screening. Are we identifying patients with COVID symptoms? Or even if they don't have symptoms, now that the testing guidelines have changed, are we still connecting these patients to get that COVID testing? So it kind of depends on the survey that we're talking about, or with telehealth. Obviously, our success metrics are we completing telehealth visits? We also, we just implemented a patient satisfaction survey as well to send out to patients who had just completed a telehealth visit. So it asks, you know, could you easily log in? Was the quality of care acceptable? Would you have a telehealth visit in the future? So we're starting to monitor that data as well to help us to change our processes if we need to, or expand on our processes and understand how patients are perceiving this new telehealth system of care.
Awesome. Okay. Well, that's the time that we have. Cassie and Kelly, thank you so much for giving us a slice of your experience with a health innovation company in our portfolio, and just how it's impacted the Upper Great Lakes Family Health Center. So thanks for taking the time today, and really appreciate it.
It was a pleasure.
Thank you.